What are the main factors you should consider when deciding to have a knee replacement? First of all, how bad is your pain? Stiffness, swelling. Secondly, how severe is your osteoarthritis? Finally, how much is your pain affecting your quality of life? Normally, we start with treating osteoarthritis conservatively. If you don't respond well to conservative measures, including physical therapy, cortisone injections, anti-inflammatory medications, and sometimes viscosupplementation, then we consider an arthroscopy, that is a vacuum and polishing of the knee. But if an arthroscopy fails to give you long-term relief and your pain significantly interferes with the quality of your life, then a total knee replacement is considered. Let's talk about what happens in a knee replacement. In other words, what's removed and what's put in. In order to understand this, we have to once again start out by looking at the normal parts list. This time, let's look at the side view of the parts list of the knee. Let's look again at the side view of this hinge joint. The thigh bone, the meniscus that sits on the leg bone, and the kneecap in the front. This is the normal knee. In a severe and advanced arthritic knee, we have the nice surface that's usually smooth and Teflon-like of the thigh bone having worn down, chipped off, and also having developed some bone spurs in the front and in the back. On the top of the leg bone, the meniscus has completely worn away, and also the back of the leg bone and often the front of the leg bone has developed some spurs. In a knee replacement, we are replacing the surfaces of these bones. Another way of thinking of this is when you have a worn out tire, you have two choices. You can replace the entire tire, or you can just get a retread and replace the surfaces. In doing a knee replacement, we just retread the knee. We replace just the surfaces. In fact, we replace the surface of the thigh bone with metal so that it looks something like this when we're finished. Cross-hatched means metal. And we replace the top of the leg bone with a layer of very hard plastic called polyethylene that is attached to metal. That inserts on top of the leg bone, often with a peg, such as I've drawn here. Again, we've replaced the worn out surfaces of the thigh bone, that is the worn out Teflon, with metal. We've replaced the worn out meniscus with a polyethylene plastic that attaches to metal, and we've removed all the bone spurs.
Each total knee prosthesis is made up of three basic components: the femoral, the tibial, and a plastic spacer that fits between the two. The femoral and the tibial components are made of metal. Attached to the tibial component is a plastic spacer. This plastic is thick and very smooth, which allows the femoral prosthesis to glide smoothly across its surface. Some surgeons will also use a patellar component to replace the surface of the kneecap where it glides in the femoral groove. The prostheses are attached to bone with cement. In order to remove the worn-down, degenerative portion of your bone, the ends of your femur and tibia have to be cut and removed to make room for the prosthesis. The tibial component replaces the end of your tibia or lower leg bone. The femoral component replaces the end of your femur or thigh bone. Your menisci or shock absorbers are removed, and the plastic spacer is inserted to take the place of your meniscus. An incision is made along the front of your knee to allow access to the knee joint. Cutting guides allow us to make meticulous cuts on the knee so that the components fit precisely, and the knee returns to its normal alignment. This is the time your surgeon corrects any alignment issues as being knock-kneed or bow-legged. No two knees are alike.